No more cases in Egypt are coming as no more cases in Egypt are coming in dermatology.
في حاجه غلط يا باشا.
ايه المشكلة؟
الجروب بي اللي هو احنا ما خدناش البنفجس.
ما خدتوش البنفجس. ماشي ندي البنفجس مفيش مشكلة يا دكتور أحمد. لكن زي ما اتفقنا in Egypt just these 3 cases are coming. No more cases. Neurofibromatosis and tuberous sclerosis not coming. But you cannot guarantee that you will go to the exam to Egypt only. You know, there is rejection now, multiple rejection, so you can go anywhere for the basis. So that you have to put in your mind, any case in dermatology can come in you in any other center rather than Egypt. Now we are going to discuss neurofibromatosis. Neurofibromatosis are famous case in the exam in the overseas and UK. As we know, station 5 is 10 minutes. 8 minutes for focal history and focal examination and reply the patient concern, and 2 minutes with discussion with the examiner. Okay, as we discussed before, we'll start with the complaint analysis, onset, course, duration, progression, and worsening factor and improving factors, and then to discuss the systemic review related to the case of the patient, and then social history, family history, medical history, and the drug list of the patient, and ask about the concern. For neurofibromatosis, the case will come to you as a skin rash and or skin rash associated with other systemic manifestation of the disease, like hearing loss or facial palsy. So this will be the scenario. This patient is complaining of skin rash for the last 5 years, for example, and recently has diminution of his hearing or facial weakness. Or maybe seizures, for example, because maybe he has acoustic neuroma causing neurological symptoms. So we will start with the rash, as we did before with vitiligo and there was psoriasis. In onset, when this rash started exactly, a course, is that rash is increasing, decreasing, or the same? Progression, is it coming with you all the time or on and off? Where is the site and the size and the color distribution? Where is this rash in your body exactly? What is the color of the rash? Do you notice anything worsening factor? Do you notice anything that deteriorates this rash? And mention it, like trauma, exposure to sun, stress, alcohol, smoking. Do you notice anything that improves this rash? Is it painful at all? Oozing? Is it blanchable? Is it itchy? Then we'll start with the neurological manifestation of the neurofibromatosis. We'll start from above down blue, okay, to put in your mind. So you will, from above, you will start with the head. This patient may have neurological symptoms because of acoustic neuroma. So you have to ask about any diminution of hearing, any facial weakness or impaired facial sensation. This is acoustic neuroma symptoms. And or all other neurological manifestation, any headache, loss of consciousness, any jerky movements, seizures, any altered motor or sensation, unsteady gait, uncontrolled water work or back passage, educational difficulties or educational problems. Okay. Then the eye, because such as this patient may have optic glioma and retinal hamartoma and less nodules. So you have to ask about any eye pain, diminution of vision, double vision, painful eye movement. Then down blue, Skeletal problems. Patient with neurofibromatosis may have kyphoscoliosis and sphenoid dysplasia and the bowing of long bones and scoliosis. So you have to ask about any joint pain, any back pain, any bone deformity. Then cardiovascular system. Patient with neurofibromatosis can have pseudochromocytoma and renal artery stenosis, and this is maybe the cause of hypertension of the patient. So you have to ask about in cardiovascular problem like any chest pain, racing of heartbeats, shortness of breath, leg swelling, any high blood pressure, and if there is blood pressure, you have to ask about is it controlled or not. Then lung. Neurofibromatosis can have lung fibrosis and pneumothorax. You have to ask about any cough, any phlegm. Okay. Then social history, as we know before, patient job. What do you do as a job? How much the symptoms impact your job and usual daily activities? If do, I'm sorry for that, we refer you to a social worker to take care of you and solve this problem for you. With whom the patient is living? Smoking history and alcohol history. Do you have any medical history of note like diabetes, hypertension? And what about your drug list? That's all with neurofibromatosis. Then ask about concern of the patient. Again, systemic review related to neurofibromatosis, neurological problems, ocular problems, musculoskeletal problems, cardiovascular problems, lung problems. Then social history, medical history, family history, and the drug list of the patient. Of course, when you are outside the station, you don't know what is the case. And when you see the case, you can know the case from the first look of the patient. You will see a lot of cafe au lait patches and neurofibromata. So that you can identify the patient from the first look. Okay, and the examination, focal examination of the patient. You will start with the complaint, the skin rash. Can you show me, please, where is this rash? And you will see the rash of the patient, inspection of the rash of the patient. Then you will examine if the patient is complaining of hearing loss or diminution of hearing or facial weakness or any neurological manifestation. You have to examine this neurological manifestation. So you have to examine for hearing aid for the patient, for diminution of hearing. You have to examine the facial palsy, and we know how to examine the cranial nerve 7. And you can examine also the ocular movement for maybe cranial nerve 6 also can be involved. And you have to examine also the fifth nerve, trigeminal nerve, because the lesion of acoustic neuroma can affect nerve 7, nerve 5, nerve 7, and nerve 8, and sometimes nerve 6 also. So what we are going to do mainly in this patient is to examine the neurological manifestation of acoustic neuroma of the patient. Nerve 5, 6, 7, and 8. Okay? Nerve 5, by examining the sensation of the face bilateral, by putting your hand or your fingers on the temporal area, maxillary area, and mandibular area, and ask about the sensation. And also to examine the movement of the jaw laterally, bilaterally, deviation by deviation, by deviating the the chin of the patient against resistance. And for nerve 6, you have to examine for ocular muscle movement. You order the patient to move his eyes, and during moving and to focus his eyes on your finger and moving your finger in each shaped position to see if there is any paralysis, ocular muscle paralysis. And for nerve 7, of course, to examine for ocular movement and to make the patient to smile for you if there is any angle deviation. And also to make the patient to elevate his eyebrow for frontalis muscle involvement. And also for orbicularis oris muscle. And also to order the patient to blow. يعني تخلي البيشنت ينفخ and to smile and to close his eyes firmly, and you will try to open the eye, and also to close his mouth firmly and to try to open his mouth. This is for nerve 7. For nerve 8, by examination, Weber, some candidate can ask about Weber test and the other test. Weber and what the other test?
Rennie's.
What?
Rennie's test. Weber's and Rennie's.
Yeah, Rennie's test and Weber test. You can do in the exam also if there is diminution of hearing for the patient. Also, in the examination of neurofibromatosis, ask the examiner, I'd like to examine this patient blood pressure, because such this patient may have few chromocytoma and high blood pressure. And I'd like to examine this patient eyes with fundoscopy, because such this patient may have optic glioma and retinal hamartoma. Of course, the examiner will not allow you to do. So the main examination here is skin rash and the neurological and the acoustic neuroma symptoms and the hypertension for few chromocytoma. Also, you can examine the lung. I'd like to ask the examiner also, because you don't have time, I'd like to examine this patient's lung for lung fibrosis and the pneumothorax. That's all in the examination. Don't forget that I'd like to see this patient chart. This is in all cases actually. You have to ask for the chart of the patient for vital signs, for respiratory rate, temperature, blood pressure, and respiratory rate. I'd like to see this patient chart. This is in all cases, not to forget. Concern of the patient of neurofibromatosis. What could be the cause, doctor, or what could be the problem, doctor? You will tell him most probably you have a disease which is causing multi-system affection involving your skin and some cranial nerves, maybe your lung, and they're causing high blood pressure, and also can involve your wounds. So what you are going to do is to do for you partial blood test and the imaging to confirm our diagnosis. Then if confirmed, we will refer you to a multidisciplinary team to give you the proper plan of management. Is it curable, doctor? I'm sorry, it is not curable, but it can be treated. Treatment is available to control your condition. What about my children, doctor? I have 3 or 5 children. What about my children, doctor? They may have the disease. Of course, we know that neurofibromatosis is autosomal dominant condition. So 50% of the children may have the disease. I'm sorry to tell you that 50% of your children have the chance to have the disease. Okay, some of them is asking about this skin lesion. What about this skin lesion, doctor? You know, I'm feeling so embarrassed, doctor, when I'm in the society or between people because of this skin lesion. For this skin lesion, I refer you to a skin doctor and a plastic surgery doctor to solve this problem for you. Is it treatable, doctor? Some treatment is available in the form of resection of this neurofibromatosis, and laser ablation also can have some benefits. So that's all for neurofibromatosis. What you are going to do for this patient, doctor, when there is a discussion between you and the examiner? So what's your what's your finds in this case? This patient has multiple cafe au lait spots and the neurofibromatosis, and he has hearing aid and the left side facial weakness, for example. So most probably this patient has neurofibromatosis. Is it type 1 or type 2? You know, acoustic neuroma is associated mainly with type 2. So it is very important to mention, is it type 1 or type 2? We know that the criteria for type 1 neurofibromatosis, to make it easy, we have 3 characters in the skin. More than 6 cafe au lait spots, more than 2 neurofibromata, or 1 plexiform neurofibromata, axillary or inguinal trickling, so that don't forget to examine the axilla and the inguinal region of the patient. These are 3 characters of the skin. Then an eye, more than 2 lash nodules, and optic glioma. So we have 2 characters in the eye. More than 2 optic glioma and lash nodules. Then the musculoskeletal, this patient may have distinct osseous lesion. And of course, first degree relative with neurofibromatosis. These are the 7 criteria of type 1 neurofibromatosis. For type 2, what is the criteria? Bilateral 8th cranial nerve involvement, and confirmed on the CT. Or first degree relative with neurofibromatosis and one of the following: meningioma, optic glioma, schwannoma, neurofibroma. So investigation to be done for the patient. Basic investigation: CBC, electrolytes, kidney function, liver function, and of course CT or MRI brain if the patient has signs of diminution of vision, diminution of hearing, or facial weakness, or facial sensation disturbance, or eye movement problem, or diplopia of vision, any neurological manifestation. So, what's the management for this patient? This patient needs patient education and counseling, occupational therapy, and psychosocial support. And this is non-pharmacological. patient education and the counseling. These are in most of the cases actually non-pharmacological patient education and counseling, occupational therapy and psychosocial support, and pharmacological. This patient need multidisciplinary team treatment for his condition involving the dermatologist and maybe neurologist and also chest physician if there is any chest symptoms, and cardiovascular for his hypertension. So that is all for neurofibromatosis. Okay, open discussion if anyone wants to ask. You can open the mics and you can ask what you want.
كلمة سيزر بس لما بسأل عنها في الهيستوري what can I say?
Again, please.
Caesar. What can I say to the patient to ask about Caesar? Do you have what?
Any checking movements. We know that you have to avoid jargon with the patient, so we have to ask about the symptoms simply. Any other question? Dr. Sam, you can mute the cam from down blue.
I will try, Dr. Sadi. 1 moment.
Okay. So, Dr. Sam, we discussed already neurofibromatosis station 5. This patient can come with a scenario of a skin rash and diminution of hearing or facial disturbance sensation or facial weakness or maybe diplopia of vision because of acoustic neuroma lesion. And if there is acoustic neuroma lesion, most probably this patient has neurofibromatosis type 2. And we know the criteria of how to diagnose neurofibromatosis type 2. If we have one, bilateral cranial nerve involvement, confirmed with CT, or we have first degree patient relative with neurofibromatosis type 2 with one of the following: neurofibromata, schwannoma, glioma, meningioma, أي حاجة فيها أوما.
Hello, Dr. Sadi.
Okay, any question? And neurofibromatosis?
Yeah, I just wanted to ask one question. Can you hear
Yes.
me? Yeah, regarding this evaluation of any rash, you said that site, color, symmetry. I want to ask one question. When you enter the examination room, the patient, the rash is clearly visible to you, or on examination it is visible? Because if the patient is already sitting and you can see the rash, still you have to ask where is the site, where is you having the rash, what is the color, what is the symmetry, because you can see the rash very clearly. What is the where is the site, what is the color, what is the symmetry? So just want to say,
Dr. Amjad, I appreciate your question, but sometimes the rash is not clear. The patient may be fully closed, fully hearing is closed, so that you cannot see the rash properly.
So then you have to
Okay, so you have to ask about where is the rash in his body. Maybe he has, for example, psoriasis, and this psoriasis is not obvious for you. Maybe the psoriasis in the knees, and his wearing his clothes already. Maybe the psoriasis in the back mainly, and you cannot see the rashes.
So the history and physical examination starts at the same time. If the rash is not visible, you have to ask them, can you please show me the rash? Directly entering when you're starting the conversation.
Yes, Dr.
Right?
Amjad, you mean that no need to ask about where is the rash and what's the color and description of the rash like that?
Like, for example, neurofibromatosis.
It's okay, but you know, I think it's better to ask. It will not take time from from your time to ask about where is the rash in your body, what the color of this rash. You know, sometimes pemphigus, for example, pemphigus is coming not in in the way that you can diagnose, pemphigus is coming in the form of just scales and just hyperpigmentation. The patient is under treatment already, so that you cannot say this is pemphigus. So you have to ask about what about this skin rash? How does it started with you? Was it filled with fluid and ruptures easily, like that too? This history can give you idea about this rash, when it is started, how is it started, how it was changed.
Okay.
So, what system are involved in neurofibromatosis? As we said before, the skin in the form of cafe au lait spots or patches, neurofibromata, and inguinal freckling and inguinal and axillary freckling.
Axillary.
This is the skin manifestation. Then neurological manifestation in the form of 5, 6, 8, and 7 cranial nerve involvement. Okay? But of course, not all these cranial nerves can be involved. Only maybe 1 or 2 cranial nerves can be involved only. Then, cardiovascular, this patient may have few chromocytoma, so that blood pressure is very important, and also renal artery stenosis. These are the causes of high blood pressure in this patient. And then lung, this patient may have lung fibrosis, and maybe have pneumothorax. Then the musculoskeletal, this patient may have osseous lesion, kyphoscoliosis, or bowing of the long bones. Bowing that I mean that you will find deformity of the long bones. So that's all for neurofibromatosis. We'll shift to the other case, hereditary hemorrhagic telangiectasia. Not coming frequently in the exam actually, but it can